Thank you for joining us at the Surgery Center Teddy Bear Clinic. We started this program in 1996 to help our youngest patients feel more comfortable with their surgical experience. Today we will be following Rachel through on her visit with us. We hope that by watching this, you'll feel more comfortable when it's your turn to see us.
The other day I went to the doctor and she told me I need to have an operation to remove my tonsils. I was a little scared, but it really wasn't bad. Let me tell you about it. On the day of my surgery, we went to the surgery center. It's right next to the hospital. There were a lot of people waiting to have surgery. The first thing we did was go to the lady at the big desk.
Good morning. Good morning.
She had Mom and Dad sign some papers.
Signature right there on the bottom line.
After that, she put a name tag on my wrist. She put one on Brownie, too. That's my bear. After that, we went to a waiting room they have just for kids. I met another girl there, too.
Hi. Hi, I'm Marissa. What's your name? Rachel. Well, what are you having done?
I'm having my tonsils taken out. You? After a little bit, a nice lady came to take me and my parents to meet my nurse.
Rachel?
Can my mom and daddy come?
Sure, absolutely. Hi, Mom and Dad. Rachel, I want you to meet Barb. She's going to be your nurse today.
Hi.
Okay?
Then we met Barb. She was real nice. The first lady we met took our coats, and then we were on our way.
Okay, Rachel, right across the hall.
Barb was real neat. She told me about the special clothes I had to wear to keep bad germs away.
Okay, Rachel, the first thing we're going to do is have you change into this little hospital gown. Do you know why we wear hospital gowns? Well, outside you have germs, and inside we want the hospital to be nice and clean. So if we brought our clothes outside in, we could be bringing germs in. So if we change into the hospital gown, we'll be clean. It's also why I wear these special clothes here too. So let's go get changed. Oh, it looks like Teddy's ready. Are you ready, Rachel? All right, come on. First thing we need to do is get you weighed to see how big you are, okay?
After I put on the special clothes, and Brownie too, Barb checked out my height and weight. Then we went into a new area where you get ready for surgery. They call this pre-op. My new friend was there too.
Hey, how you doing?
Good.
Gotta close this up now, okay? Okay, Rachel, I have a nice warm blanket for you.
Barb gave me a warm blanket because it was a little cold just laying there.
Rachel, in this area, we're just gonna get some numbers to see how strong you are. I need to talk to your parents and ask them a few questions, and later on you'll be meeting your doctors again, okay? Okay, let's put this on your arm. It's gonna give you a nice hug.
After that, she checked my blood pressure, she checked my heartbeat, and she checked my temperature. Then she said I was in good shape.
Now listen, here we go. Hear all that? Oh, look at your numbers. That's like a math test. You want an A+ on that, and you got a 99.
Yeah.
And your heart rate's 99, and we're gonna wait for your pressure to go tell us in just a minute. I also need to take your temperature, okay? And I'm gonna do that in your ear, so it's real quick.
None of that hurt at all. It was just the stuff they need to do to get you ready.
Now, Dr. Eisner is going to be here soon to tell you about how you're going to take your nap with us. But I also want to tell you, while you're back there taking your nap, they're going to give you a little...
She told me about a small tube called an IV that was going to be put in my hand. I was a little afraid it was going to hurt, but she told me it wouldn't.
All right?
Is it going to hurt?
No, it's not. It's going to be done after you go to sleep, so you won't know anything about it. It's just going to be wrapped up there, okay? And it attaches up to here. Since you didn't have breakfast this morning, we're going to
Barb really made me feel comfortable. After she checked me out, I started meeting my doctors.
Here comes Dr. Eisenhower.
Hi, Rachel.
First, I met the anesthesiologist. That's the doctor that helps you take a nap. Uh-huh.
Oh, that's good.
He showed me the mask that would help me fall asleep. He wanted to know what flavor it was. Strawberry cross cherry cross tropical punch.
Ah, okay. And what you do is you breathe through that and you blow up a balloon. Yeah, we'll hook it up to a balloon, and when you do that, when you wake back up, the operation's all over with.
So what do you think you're going to want to drink when you wake up? We have
Popsicles.
we do have popsicles, and we have juice, apple juice. So you may feel a little different when you wake up, but you just let us know, okay?
Okay.
All right, well, here's Dr. Smith.
You ready to get those tonsils out? Okay, now remember, there are two very important things when you have your tonsils out. The first is that your throat's going to hurt a little bit, but Mom and Dad are
Next, I met the surgeon. She said my throat was going to be a little sore when I woke up, but that was okay, because I was going to get lots of popsicles and ice cream.
So juice or popsicles or milk or my favorite ice cream.
Yeah.
Okay? Any questions?
On the ice cream, could you have sundae toppings?
I think that'd be okay.
Yay!
All right.
You are doing great, Rachel.
I was sure meeting a lot of new people. Next, I met one of the nurses from the operating room.
Hi, Irene.
Is this your baby?
This is Brownie Beer Bob.
Oh, okay. Is Brownie Bear Bob going to go in the room with you today? Good. That's good. What are you
I was glad Brownie was coming with me.
Hey, Rachel. It's hugs and kisses time.
I guess I was ready to go. I kissed Mom and Dad, and they took me to the operating room. They call it the OR.
Okay, your bed at home got wheels on it?
Barb told my parents they could wait in the lobby.
Hey, Rachel, we're here now.
The OR was real clean with a lot of lights. Everyone really knew what they were doing.
Okay, let's put this little thing on your finger there, Rachel. There you go. Okay. Okay, Rachel, let's see if this mask fits the bear. Think that mask works over there? Nah. Let's see how good of a balloon blower you are here, okay? There, you can hold.
Brownie tried to blow up the balloon, but he couldn't. I blew up the balloon, and when I did, I just fell asleep.
Look at that. Look at that balloon.
After surgery, they take you to a place called recovery. In recovery, another team takes care of you. They are called the post-op team. I didn't know they were taking care of me because, well, I was still sleeping.
She seems to be doing fine. While she's waking up, I'm going to go talk to her parents. Let them know that she's finished with surgery and that she's fine.
Okay.
And I'll let them know that you'll come to get her in a few minutes.
Okay. Hey, Rachel, you're just waking up in recovery. How you feeling?
Good.
How's your throat feeling?
Now, when I did wake up, the first person I saw was Lori.
Expected, but I can give you some medicine through your IV to make it feel better.
Okay.
We'll also go get Mommy and Daddy, and in just a few minutes we'll get you back into phase 2 recovery. How about that?
When I totally woke up, they took me back to phase 2 recovery. It's kind of neat. All the beds have wheels on them.
Rachel, how Mom and Dad?
How you doing?
Sweetheart,
You
she's
okay?
done wonderfully.
That's where my mom and dad could see me, and that's where you get a popsicle. After a little bit, I sat up in a chair. The nurse took the bandage off my hand because it was feeling tight. Then my surgeon came to see me. She said I did great.
I understand you're about to go home. Now remember, you're going to do lots of drinking for me, right? Lots of juice and popsicles and anything else that feels good, okay?
The anesthesiologist came to talk to me. He said I was doing well enough to go home, but I still had a job to do.
Job now, next couple of days, to drink lots of fluids.
Okay.
Okay?
Hey, Rachel, you ready to go home?
Yeah.
All right, I just need to listen to your heart and check your blood pressure one more time, and then we can get out of here.
After Lori checked my heart, we were ready to go.
You've done a great job today.
Thanks.
All right, we're gonna go right out this way. Rachel, thanks for coming. I hope you get to feeling better.
Probably will.
And we'll give Mom and Dad a call tomorrow to see how you're doing.
Okay.
All right.
Come on, Brownie, let's go home. Everyone at the surgery center was really nice. And Brownie and I learned a lot about surgery.
We hope that you have found this video helpful. If you would like a tour of the Surgery Center, please contact us for an appointment.